Hey, it's Dr. Greenberg. So I'm about to start another massive weight loss patient. This patient lost about 100 pounds. And when the patients lose that much weight, they have a lot of extra skin and sagginess, both in the breasts. You can see the breasts are droopy. And what we're going to do is do a breast lift. And in this patient, an extended tummy tuck. We're going to do liposuction on the sides. We're going to make a low incision. We're going to get rid of all this extra skin and make her much tighter and much flatter. We fix the muscles of the abdominal wall, and we bring those in. It will flatten her down and remove the extra skin. And then we'll extend the incision around to the sides to get rid of as much on the sides as we possibly can. So with the massive weight loss patients, we typically do breast surgery where we can do a breast lift. We can do an extended or a regular tummy tuck. And sometimes we'll do some treatment on the legs, cellulite treatment, liposuction, thigh lifts, and things like that. The combination of massive weight loss patients, redoing these patients' bodies is really critical after they lose a lot of weight. Extra skin goes everywhere, arms, legs, belly, facelifts. So we do this in a staged process. Typically we'll start with the abdomen and the breasts. Often we'll do the face and arms and other combinations, but getting the extra skin to go away is critical to reshape the patient's body and reshape their lives.